wish I would have done that. Oh, I have goosebumps right now when I say this.
I'm gonna get emotional.
All right. Good afternoon, everyone, and welcome to our school session series. This is another installment this evening. This series we've built for our potential students, our current students, our registered students, any student that's looking at Lambton College to learn a little bit more about our programs and meet our faculty, our coordinators, and some other people from the college as well. So tonight, our main topic is going to be the School of Health. So we have a number of our faculty are going to showcase what our students are up to right now inside of their program and what the fall will look like. This series is built to really give you the information that you need and are looking for. If you're thinking about applying, maybe you're looking to go back to school, maybe you have already submitted an application and you have an offer and you're just really trying to make a decision and see what's happening. That is another great opportunity for tonight. So again, I hope you enjoy the speakers that we have. Feel free to post any questions that you might have. Myself and any of the speakers you hear from tonight will definitely work to answer those questions that you might have throughout the event. So my name's Sean. I am the Enrollment Initiatives Coordinator for the college, and I will be your host for this evening to walk you through the School of Health. We have a number of programs that our Lambton is known for. We have a brand new facility, the Nova Chemicals Health and Research Center, that houses a number of our labs and our learning facilities. So students definitely do get the top-notch environment that they're able to learn in their lab setting. So we have a lot in store this evening, and we're really excited to kick things off. So to kick things off, our first speaker tonight is Savannah McDonald. She is the Dean of the School of Health, Community Services, and Creative Design. So I want to bring her up and have her welcome you to this event and give you an update in terms of what the fall looks like for our program in health.
Great. Thanks, Sean, and good afternoon, everyone, and welcome. We're so excited that you've taken some time today to join us and ask any questions that you may have about the fall. So on behalf of myself, our faculty, and staff in the School of Health, welcome. We are really excited to be in the position to welcome back more students back to campus this fall. Welcome back our students, back our staff, and welcome back our faculty. And that's really what we're gearing towards. Right now, our faculty are working hard on planning for September. We have been able to offer a lot of our health programming, in particular our hands-on practical labs, in person throughout the pandemic. We've been given special permission from the ministry as well as from Lambton Public Health to again come into the building and to learn and practice safely in our practical skills lab. And we're hoping that we'll be able to offer even more opportunities for students, faculty, and staff to be in the building this fall. So we do remain really confident and optimistic that we'll have a very robust academic student life experience when we return to campus this fall. All of our decisions, though, are absolutely aligned with public health guidelines. And so as we begin to get a firm handle on COVID and more people get vaccinated this spring, summer, we really do plan on continuing to make sure that safety is our number one priority for everybody coming into the building. But we again are hoping to increase as much as we can access to our campus, access to our labs, and other experiential learning opportunities for everybody this fall. as we move forward, not only will there be more opportunities for students to get into the building to learn, but there'll also be opportunities for students, we hope, to have access to the athletics and fitness complex and other organized events from the Student Administrative Council. So, you know, the million-dollar question is, well, how much in person are we going to have? And I wish I had the crystal ball or the magic 8-ball to give you that answer. But what I will say again is that health and safety will remain our #1 priority. And please check back on our website frequently, because it's an ever-changing situation, as you know. So we're going to continue to monitor it. But as I said, we're really hopeful to see you in the building this fall. So thanks, Sean. Over to you.
Awesome. Thanks so much, Sylvana. And I think the big thing that, just to highlight, is we are looking at how do we emphasize and increase the time that our students are on campus, but we're also doing it in a very customized approach. So we're looking at every program individually and making sure we give every student that's in those individual programs the best possible experience. So I'm really happy that you're able to provide that update. And as you mentioned, look at our website, lambtoncollege.ca. That's where any key information is going to be posted, as well as if you are a registered student and planning to join us in the fall and you're all set and ready to go, just keep an eye on your email. Email is #1 in terms of communicating with students. So make sure that you are checking your email. That's where we're going to send any updates and all that fun stuff. So that's what the fall looks like. More details will be coming up, especially as the pandemic, we get past this third wave or whatever we might be in at this point, and on from there. So now that we know kind of what the fall is going to look like in terms of the delivery, next up on the agenda tonight is to really dive into some of our programs. So the first program area that we're going to look at is our pre-health programs, which makes a great first step and a first start, because the preparatory programs is a really great starting program, especially looking at the benefits of taking the preparatory programs, getting you set up and getting you ready to go. There's many advantages, and to talk to you about the advantages of the preparatory program, pre-health, I'm going to invite Barb Dobson, our coordinator, to give you an overview.
Thanks, Sean. Am I on? Good to go? Okay. Hello, everybody, and nice to have you here this evening. My name is Barbara Dodson, and I'm the coordinator of the Pre-Health Sciences programs here at Lambton College. And we have two of them, two streams, if you will, of that program. One is for students who are interested in going into a diploma program, such as practical nursing. I've got those, a list of some of those choices you might have coming up. And the other stream is for students more interested in doing an advanced diploma or a degree. Specifically, our program has been aligned and we have an articulation agreement with the University of Windsor for their Bachelor of Science in Nursing. So I'm hearing somebody's talk here. Little. Thanks. Okay, so next slide, please. Okay, so this program is short but mighty, as I say. It's only 8 months long, 2 terms, but these programs, both streams, provide you excellent preparation in so many ways, and we have shown this repeatedly. We have studied our graduates of our pre-health science programs on how they do when they get to their destination program, which is what we call it, where they want to go next, and shown repeatedly year after year that students who do well in our pre-health programs do well in their next program as well. So though you will spend an extra 8 months doing this program, you may save yourself that 8 months later on, because you're more likely to pass all your courses in your next program, be able to progress without the difficulty of perhaps not getting a prerequisite for a future course. So it's an excellent program for you if you've lacked any of the prerequisites you might need to get into this program, as sciences or biology or math that you might need to get into a program. You may not have them. You may not have achieved the marks in high school. You may have been out of school for a while and just want to come in and get used to studying and learning at college level. All very, very good reasons to take this program. The focus is on the fundamentals of science, math, and communications, and all of our biology and chemistry labs, chemistry courses, have lab components. and I am speaking to you from our brand new, beautiful chemistry labs, just renovated and up and running in the last couple of years. They're lovely with state-of-the-art ventilation systems, which is comfort right now. Next slide. So what have we designed these programs to do? They give you, both streams give you a competitive edge in gaining admission to the program of your choice in your chosen healthcare fields. They also offer you an opportunity to get some guidance towards reaching your personal goals and career paths. You may not be sure at this point which health science program you want to study, and this program allows you to prepare and get ready for any of them really, but also to talk to counselors, to talk to program coordinators of the course programs you might be interested in, to your faculty about where you might want to go next. Some students do change their minds. In fact, it's quite common as they go through this program. As I mentioned earlier, the academic preparedness has been shown year in and year out, how well prepared our students graduate the pre-health programs are for the next step. It's really the big, big bonus of this program as I see it. You'll also, if you're coming from high school or you've been out of school for a while, you'll learn how to study and learn at college level, and there's so much importance to that. That's a huge benefit also to this. And here's another great point. In the last few years, both streams of the pre-health science programs have been aligned. The courses and the curriculum that you will take at Lambton College are exactly the same courses and curriculum that students in the pre-health science programs at other colleges take. They're aligned province-wide, the curriculum. So other schools, if you're interested in a pre-health program that Lambton doesn't offer, for example, dental hygiene or respiratory therapy, the colleges that do offer those programs will recognize our pre-health curriculum as the same as theirs, which is a real advantage in terms of transferability for you. Next slide. So here is a course list for the pre-health sciences stream for certificates and diplomas. In both terms, you'll take biology, chemistry, math, and communications. All those preparatory subjects that are going to really help you understand the material in your subsequent courses and succeed at them. In the second term, you'll have a choice of taking an introduction to healthcare course or a physics course for pre-health sciences. You'll want to take that physics depending on where you want to go next. Some programs that you want to go to next will require physics. So once you're more sure in term one where you might want to be studying or what you might want to be studying next, you may want to choose that physics if it's a required course. Next slide. For the pre-health sciences stream to advanced diplomas, that's a diploma that's 3 years long or a degree. You'll want to take the stream PHDP is the code. Again, like the other stream, you'll take biology, chemistry, math, and communications in both terms. In term one, you'll take an anthropology and sociology course. And in term two, you can choose to continue with that anthropology with a second course. If it really interested you, keep going. A lot of students actually really like that course. Or you can take a gen ed course, a general education, a course of your choice. We also have an English literature course in the second term of that stream. You may think, why another English? It's been shown that reading of literature, you gain empathy with characters in the book, and this increases empathy skills in general. And empathy is a very, very strong characteristic to have if you want to be a nurse. Next slide. So here's just a list of some of the programs offered at Lambton College that you might be interested in going on to when you finish the stream, the pathways to certificates and diplomas. Massage therapy, practical nursing, paramedic, pharmacy technician, retail pharmacy assistant, personal support worker, huge demand for those folks right now, therapeutic recreation are just some of them. Next slide. For the stream for advanced diplomas and degrees, primarily our students are aiming for the Bachelor of Science in Nursing collaborative program that I mentioned that we have with the University of Windsor. And we do have seats held by the University of Windsor for our graduates of the pre-health science stream who do meet their admission requirements. Any advanced 3-year diploma, that should say, sorry, it says certificates, or health science degree anywhere, this could be a first step for you. Next slide. All of our labs, the ones that you'll take in the pre-program, in which I'm sitting in one of them, but also in your destination health program where you go in our brand new health science building, our state-of-the-art brand new facilities that you basically won't find better anywhere. I'm just going to close with, next slide, Sean. And that's my email address if you'd like to be in touch with me and ask any questions you might have about either of these programs. Just before I go, I'm going to show you a quick peek at an apparatus that I've got running here in the lab today on distillation. Distillation is a way that liquid mixtures are separated based on difference in boiling point. Just for a little fun there. Any questions?
Awesome. Thanks so much, Barb. What a great way to kick things off tonight. I do want to ask, I guess, the golden question for our pre-health programs is why ultimately would a student consider taking the pre-program before they even start another health program? So what's the benefit of taking that preparatory year?
Well, one thing I love to say in answer to that question is students have come to me in my office. I've been the coordinator of the pre-health sciences programs here for 10 years. Students have come to my office so many times, many times, and told me, I am so glad I took that program. They really see the benefit when they do go to that next step, and they're just sailing through their courses, seeing some of their classmates struggle sometimes, and they, in hindsight, are very glad that they took it. So that's something to think about when you're moving forward, right? Might this year help me succeed and do better as I work through my next step? The answer is our evidence has shown repeatedly that it does. So it's 8 months well worth spending.
Well, that's awesome, and I think especially now with the way things have changed so much for so many students taking the preparatory program,
yeah,
it's a great way to get back into the educational world perhaps, or get those skills a little bit tightened up and freshened up for when they are ready to take the next leap over to the diploma or the degree or whatever pathway they might be looking at. So again, pre-health is definitely a great option. There are seats available for the fall, so if anybody's considering health sciences and wants to take that kind of starting point, that starting first year, pre-health is definitely the way to go. So thanks so much, Barb, for your time today.
You're welcome.
Okay, so that was a really great introduction. Next up on the agenda is to look at our occupational therapist assistant program, our OPTA program. One of our relatively new programs that we've launched within the college. This is a postgraduate program as well, so there are some options to take anybody that might have a degree or prior education and wants to get into this world. So joining us from her lab this evening in our Nova Chemicals Health and Research Center is Melissa Fogarty, who coordinates the program, and she's going to talk to you a little bit about what's happening in her program for the fall.
Hi everybody, I'm Melissa. I'm one of the professors in the OT-PT Assistant program, and I'm here to welcome you to the OT-PT Assistant Lab and just to give you a little taste of what it's like to do some of our hands-on activities. And this is...
Hi everybody, I'm Allie, and I'm also a professor here in the OT-PT Assistant program, and I'm going to be demonstrating some of the activities today while Melissa tells you what's kind of going on here in the lab.
So Allie and one of our patients will show you some of the things they might work on are upper and lower extremity exercises. So Allie is working away on her lower extremity exercise with the ankle weights there. From the physio assistant standpoint, they also might work on modalities of science. So things like ultrasound, muscle stimulation, laser. So you'll have an opportunity to learn and try a variety of those things. Next up, from the OT assistant standpoint, is a lot of times we're responsible for teaching our clients how to dress in an adaptive way using adaptive equipment. So two of the pieces of equipment we'll show you right now are the sock aid and the reacher. And Allie is going to show you how she would use this equipment.
So a sock aid is an adaptive piece of equipment that allows somebody who can't bend to be able to put their sock on. So you put your sock on the piece of equipment, you throw it down to your foot, you put your foot into the aid, and then pull your sock on.
We had some tricky socks today. We had some tight socks. So next up is the pants, putting on a pair of pants using a reacher. So if someone can't bend or they have some restrictions from surgery, they're going to put their weaker leg in using the reacher. And if they, so with practice, a lot of times it's easier to put on when you don't have another pair of pants on. But great job, Allie.
Thank you.
And while Allie's taking her pants off, other restrictions, other things that we learn are how to adjust crutches for people, how to adjust canes. So those are things that you'll practice in the lab as well. So that's something that would be your responsibility once you're out in the workforce. Next up is, we have the good old rollator walker here. So we would fit the client for the rollator walker, but we also are responsible for teaching them how to use it safely. So Allie's gonna just walk around. Allie, you might want to slow down there. You're going a little bit fast. Great job. Oh, and just stay inside the walker when you're walking there. So Allie's going to show you how to just sit on the walker safely. She put her brakes on, and then she's going to slowly lower herself. That's great. And then perfect. Yeah. And so if someone's sitting on a walker, you want to make sure that it's just for a rest break, not just to sit there and be pushed on it. When someone needs to be pushed, they would use a wheelchair. So we like to have a lot of fun in this lab. And sometimes we want the therapist to really understand what it's like to be in a wheelchair and to move it before they can teach someone how to use it. So we like to incorporate, some competition, some wheelchair races. Allie lost 10 seconds there because she hit the cone.
I'm out of practice.
And you would move the footrest out of the way. So we would teach them all the basics about wheelchairs and how to teach people. So moving on, we are going to look at the back of our classroom. We have the staircase there for our clients to simulate our clients practicing stairs. We have our skeleton here who we're yet to name, so that'll be a competition next year to see who can come up with the best skeletal name. And Allie's over there working away on her exercises with the TheraBand and her balance as well. So there we go. And next, Allie's going to show you some exercises that are going to work on balance. So here's our parallel bars. She's going to hold on and step on the balance discs there. Great job, Allie.
Mr. Bones, a little high five.
Oh, just moved his elbow too well. And lastly, Allie's going to just demonstrate a few activities that we might use from the OT standpoint, OT assistant standpoint. So go ahead, Allie.
So one other thing that you might learn in our program is how to work with a pediatric population. So you might work with kids in schools or maybe in a clinic or at a children's hospital. And some of the different things you might learn here are how to teach kids fine motor skills. So that might involve things like beading and lacing. So how to put beads on a small string. You might do some kind of play-based learning like Jenga. So working on some fine motor skills. You might learn about visual perceptual skills. So how do people see and understand things? So we might play a game like Spot It, where you got to try and find the matching picture on each one.
Can you find it?
It's the tree. You might work on something like problem solving skills. So how do these pieces fit into this last little space here? Is it like this? We got it. And you might work with kids on things like writing and how letters are formed. So using pieces to make different letters like a small b or a big B. So those are some of the pediatric interventions that you might learn here and some of the different activities that you might get to learn if you come and join our OT PT assistant program.
We're really looking forward to seeing you in September. And if you have any questions and need any more information, please contact marketing and they will send you my email address. I'd be happy to talk with you. Thank you.
Awesome. Thanks so much. I think that was a really great overview of the lab and what our students do inside of the program, and some of the things that are going to be in store for the fall. So thanks so much, Melissa. I really appreciate your overview and your time this evening. So a couple things just want to highlight. First and foremost, for those that are attending this event and any of the events in the series that we have, you are entered into win tuition, which is great. So we are giving out tuition for anybody that attends one of our school session events and also confirms their offer by May 31st. So by the end of the month, if you have an active offer and you confirm that offer by the end of May, you can potentially get your first year's tuition on us, which is a great cost savings. So definitely, if you are looking at Lambton College, that's another incentive for you to get your confirmation in before the end of the month. So before we move on to the next presenter in the next program, I do want to take a question. I believe we have one question that's come in so far. So we'll go ahead and pull that up on the screen and see what that looks like. So is Lambton College going to start offering the 4-year Bachelor of Science in Nursing program soon without having to go to Windsor? So really great question. Obviously a hot topic. Definitely it is in the plans. It is in our academic delivery plan, but we don't have a start date for that. So I know that our faculty in the BSCN program are actively working on curriculum and working on getting that going, but there is not a set start date, but we're definitely looking forward to being able to offer the 4-year degree solely on our campus. So when more information is available, we'll definitely make sure any of our students that are interested in BSCN are aware when we're able to do so. Okay, hopefully that answers that question. And next up, without delaying any further, one more question. Okay, I think we have one more question. We'll pull that up before we bring on Connie Beck from pharmacy. What is the typical starting wage of an OTPT? Well, that is a great question. I will have to connect with Melissa. I don't know if she's on the line anymore, so we will endeavor to get that information, and I will definitely provide that answer for you. Okay. Good questions. So far, so good. Again, any other questions that you have, post them in the chat. I'm here to answer them tonight, and then we can also take anything offline or do some more research if we have to do so. But next up on the agenda is learning about our pharmacy technician program. I think this is a really great career path if people are looking at getting in the healthcare field. A lot of job opportunities, which is always something people look at when they're looking at programs, obviously. And to share what's happening inside of our pharmacy technician program, joining us tonight is Connie Beck. She is the coordinator. I know she has a lot of fun in her labs, so she's going to talk to you a little bit about what happens inside of her program and why this could be a good fit for you in the fall.
Thank you so much, Sean. I'm feeling kind of jealous because I just saw 2 presentations that were in the lab, and I know lots of fun things happen in chemistry, and they had some toys. Like I might play Jenga tonight. Like that's a good idea. It's been a long time. Anyhow, I do have a presentation, so I'm hoping that you can bring it up. Sorry, I should introduce myself. I just start talking. My name is Connie Beck. I am coordinator and professor of the pharmacy technician program here at Lambton College. And oh, there it is. It's coming up. Thank you. It helps to keep me on track. So pharmacy is absolutely a very hot job right now. I know every time I turn on the TV, all I'm seeing is vaccinations at your pharmacy, right? So what that translates into for us at Lambton College is that we need to colleges support the communities, and that's why they're community colleges. So when we look at what we need to do and what people are needing right now, I don't know about you, I really want to go back to a normal-ish maybe. So there's some ways that we can get there, and pharmacy is helping, definitely helping. If you turn on your regular TV, you're going to see pharmacy. All right. So let's talk about the program. The pharmacy technician program, it's a 2-year program. And pharmacy technicians are regulated healthcare professionals. So that means you have a license after you write your licensing exams. In order to be eligible to write those licensing exams, you have to go to an accredited college with an accredited pharmacy technician program. So we are one of those programs. It's good news. We can prepare you for your licensing exams so that you can be a regulated healthcare professional afterwards. We're able to do all of the functions of a pharmacy assistant, and don't worry, we're going to talk about those functions in a minute, because what does pharmacy actually do, right? But the important difference right now is that pharmacy technicians actually check the technical accuracy of your prescription. So if you think about a community pharmacy and you go to see your doctor, or maybe you talk to them on the phone or a Zoom call or something now, right? And they order you a prescription. We used to get a piece of paper and it would go into the pharmacy, the community pharmacy, and then it would get filled. So what technicians are doing now, what we're able to do is say, yeah, this is the right patient, this is the right drug, the right dose, the right directions, the right physician. So all of the technical aspects, and that's why we have a license, what we're responsible for. Can we go to the next slide? Awesome, thank you. So what's really important, how do you get into the program? So you're having a minimum of 60% in your grade 12 English, there's CRU, grade 11 or 12 math, again, level CRU, grade 11 or 12 biology, CRU, and grade 11 or 12 chemistry, CRU. So we know that sometimes we haven't taken all of those courses. Those are heavy courses to take all together. So if you haven't taken it, we do have academic upgrading, and our program does get some pre-health science students as well, as Barb said earlier. So keep that in mind, and please reach out to Barbara or to me if you need any guidance because you're missing one of those. We can help you. Let's go to the next slide. All right, so here it is. What do pharmacy technicians actually do? I told you we were going to talk about it. So friends think that we're making things. Look at, we're like mixing some chemicals, some crazy stuff's happening behind the pharmacy. It's super fun. We do actually teach you compounding. So how to make products that are not manufactured. It's a class, it's my favorite class, where you get to mix things together. So we do teach you how, but that's not everything. What the clients think we do, we're just talking and drinking some coffee back there, right? Who's gone into the pharmacy and seen, why does it take 20 minutes for my prescription? There's reasons why, and we'll teach you about those. It is blurry on my side. I can't see the second one there. But what the pharmacist thinks we do, well, pharmacy technicians really do everything in the pharmacy, everything except for the clinical part. That's up to the pharmacist. So that's why you see Superwoman, we're all like, yeah, we're doing everything in the pharmacy. That's what we are. Society, it's the money grab up there, right? Pharmacy's got all the money because drugs and money, right? And finally, I usually ask, what do you think that we do? So if you guys want to answer something funny and like post it there, Sean will read it out loud. I like participation. We do a lot in the pharmacy. We'll organize the pharmacy and we'll teach you all about it. A lot more happens than just counting pills. It would not be a 2-year program if that's all we were doing. So I promise there's lots more, and we're going to teach you about it. If you're interested, you'll send me an email. We'll talk, okay? Next slide. All right, here's a little bit of what we actually do and what we teach you in the program. So we work as part of a healthcare team, and I said it before, we're licensed healthcare professionals. So we have interactions with physicians, nurses, pharmacists. I'm looking at the other people. So we had OTA and PTA, and we have massage, and we have nursing. We talk to everybody. If you're a healthcare professional, pharmacy is going to be involved in some way. And we really try and achieve that at the college as well. We maintain inventory in the pharmacy, so we're receiving medications, we're making sure we have what we're supposed to have, we have all the other products that people like to buy on the shelves. That's all our responsibility. We need to make sure that there's proper inventory control. And this is more than just bottles on a shelf. There's automation in pharmacy now. So there's a lot of robotics, and we have some state-of-the-art equipment. I know you can't see it because I'm not in the lab, but we actually have 3 different pharmacy labs, and they're specialized. So we have a community pharmacy lab, and there's work areas where, you know, you do your regular kind of activity. But then we have like a simulation area in front of that community pharmacy lab. And it looks like a community pharmacy. Sometimes people knock on the window and ask, can I buy some of that Advil over there? Like, I have a headache, please. I'm like, no, it's not real. You just go to a real pharmacy. We're practicing, right? So there is a drop-off area, pickup area. There's a simulated drug cage, and then there's an area where preparation would happen. So it looks like a real pharmacy if you come into that community lab. Then we have a specialized compounding lab. And in that lab, very much like that first picture of what do, we are actually using a mortar and a pestle. That was that like ceramic looking thing that you were looking at in that picture. And we make products in that lab. And then we have a hospital pharmacy as well. And hospital pharmacies, not everybody thinks about, right? You go to the hospital, if you're admitted, the drugs come, the IV comes, it's usually maybe a nurse bringing it to you, but like, where did it come from, right? There's actually a pharmacy in every single hospital, and I'm not sure that it's something that we think about, but pharmacy prepares it and then hands it over to be given to the patients. So in that hospital lab, we teach students, how do you prepare those? And that's where we have some of the robotic equipment that packages for us. We also teach IV preparation. And again, this is something that maybe we don't think about. We kind of take it for granted, right? If you're really, really sick or a loved one has been, the IV comes to the hospital room and it's put in, but it's just not magically ready. It has to be prepared. So we teach you how to make those IV bags, and that's a sterile preparation. So we teach you how to make yourself sterilized and then how to make those IV bags. So really different things that I don't think we think about all the time. We show patients how to use inhalers, nasal sprays, eye drops, EpiPens, glucometers, and something called a peak flow meter. We participate in health promotion with events in the community. And since COVID, we've made it into like a virtual health promotion. So our students are doing things online instead to try and promote health. And I've talked about it already. We have the authority to sign off on prescriptions' technical accuracy. Next slide. Sean, if I'm going too long, you cut me off. Okay. There's very, very diverse opportunities. So this is just a small list of them. And I know when we think of pharmacy, we think about community pharmacy, right? It's the pharmacies on the corner where we bring the prescriptions. But as we've learned, at least in the last few minutes, there's hospital pharmacies. There are long-term care pharmacies. And those pharmacies are they are not open to the public. It's kind of like a warehouse, like a Costco or something, where packages and packages of drugs are just made up all day and then shipped out to nursing homes and retirement homes, because where do they come from, right? Some nursing homes do have small pharmacies in them, or if not, centralized. So pharmacy technicians can work in nursing homes or auditing them. Insurance companies. So some of you may have some plastic debit looking like cards, and you go to the pharmacy and you magically don't have to pay very much. We can work at those insurance companies because you get to learn all about insurance billing if you take this program as well. And then drug manufacturers, and there's actually a lot. So what I like to say to students is, if you take pharmacy because you want to be involved in healthcare in some way, in a way where you're not having to touch people physically maybe, that some people are not okay with it, Kelly. Okay, so there's a way that you can do it. And some people, you want to talk like me. So community pharmacy is good. I could talk all day to those patients. But then maybe you don't want to talk to anybody at all. Like maybe long-term care pharmacies for you, because you just want to do your job all day and be quiet in your work area and listen to some music. So pharmacy is so diverse with these different settings that we can help you find what's right for you if you feel like pharmacy is interesting. Let's go next slide. I don't even know how many slides are left. I'm so sorry, guys. They're waiting for me to finish. Job opportunities, we've covered this. There is so many job opportunities in pharmacy right now. If I challenge you to Google pharmacy job Ontario, enter, I don't even want to know. It's going to be a huge number. We really, really need pharmacy people right now, pharmacy technicians right now. And there's a temporary exemption right now where pharmacy technicians are actually able to administer COVID vaccines. So you have to do some specialized injection training, but that's something that's happening and hopefully will continue after the exemption runs out. So just something to think about. We're involved and you can help. Next slide. That's it. I'm done. So that's how to reach me. Finally, I'm done. So again, Connie Beck, my extension's there. I'm not at the college very much. So there's my email. But if you do leave me a message, please be clear in your message and then I can get back to you if you leave your number and your name and what you want to talk about. I think that's it. Sean, is there any questions?
I think that's good. That was a really great overview, and I always appreciate how you always bring the energy, whether you're from your house or from your lab or wherever you are, Connie. I always appreciate that.
Oh, thank you. I made you guys laugh, so that's great. I hope the people on the other side are laughing too.
I'm sure.
All right. Thanks, Sean. Thank you,
Thanks
everyone.
so much, Connie. All right. So that was a great overview of our pharmacy technician program. Again, I think you're meeting our faculty tonight. You're meeting members of the Lambton College family. And I think that's a big thing. We are a smaller college. Our average class size is 25 to 35 students in the classroom. So it really lets you get to know your faculty members. Your faculty get to know who you are, especially even now when we are bringing students on site. Obviously, we are even further limited to how many students we can have in the lab. Some are maxing out at 10 or just under 10 students in a lab. So you really do get that hands-on piece, but you get more time with your faculty to really make those connections and really make sure you're getting those concepts and you're getting those skill sets solidified. So that's always a great thing. So moving along to the next program, we have recreation therapy. So this is another option in the School of Health, maybe a slightly lesser known health career, I guess I would say, but definitely does have a lot of opportunities for our students. And there's two options that we have for this program now. There's a diploma program and then there's a fast-tracked accelerated program too. So Amanda Muskell looks after the program for us, and she is going to talk to you a little bit about what's happening now and what you can expect in the fall.
Hey, thanks, Sean. Unlike the group before us, I don't have anything, formal planned out. I do enjoy that candid interaction with my students, and I think that's the one thing that I miss the most, but I am looking forward to, as things pick up again in September. As Sean mentioned, we do have a couple of options with our program. We do have an accelerated program, which is, 1 academic year. Then we also have the 2-year diploma program, which is 2 academic years. Through each opportunity, you do have the opportunity for placements. You get lots of hands-on experience. We have some fabulous community partners who allow us the opportunity to go in and to engage and interact with the individuals that they are providing services with. And it allows for that real aspect of things. In the classroom, we can teach you theory, we can teach you different modalities, but it doesn't allow for that unpredictability or that realness of what the healthcare environment is like. And so again, through those community partnerships, we are able to create some fabulous learning experiences. When individuals hear recreation therapy or the term therapeutic recreation, many times the first question that comes out is, well, what is it? Okay. Many people just think that it's all fun and games. And while that is definitely a big part of what we do, and which is why so many of the individuals, the patients that we work with, love our service, there is a much bigger picture that individuals have to recognize and they have to appreciate. Instead of, we don't just randomly select different types of recreation and leisure and say, okay, let's go and have fun. Everything that we do, it is purposeful. Okay, we have goals that we are trying to achieve. We have objectives. We have things, that we are trying to measure so that we can determine whether or not we have achieved our goal. And so back to the question of what exactly is recreation therapy, it is a holistic approach to an individual's health and to an individual's wellness. And so we are looking at an individual's physical well-being, their social well-being, social or emotional, mental, spiritual. Those are all things that we are taking into consideration because we follow the idea, we follow the belief. An individual is sort of like a bicycle wheel, okay? And if all of our spokes aren't strong, then our wheel is not going to work very effectively or very efficiently in getting us through our daily tasks and our day-to-day living. And so we address each of those areas. And so we're using recreation and leisure. There are two different ways you can look at it. One, we are using recreation and leisure as a tool to help individuals achieve certain goals. The other aspect of what we do is working with individuals after they have sustained a life-altering injury or illness, and we examine the recreation and leisure activities that they enjoy doing prior, to their illness or injury, and what it is we need to do to modify, so that they can continue to engage in those sort of activities. So an example would be, and I know, in Southwestern Ontario, like many parts of the province, hockey, is a very big part of many individuals' lives. And it's a big part of their identity. You have kids who start off, really young, and that's where their peer group starts to form. And then, as they progress through, the different levels of hockey, again, they have their friendships. Hockey is a big part of who they are. Well, if they sustain an injury that prevents them from playing traditional hockey again, we need to start taking a look at what can we do as a recreation therapist to help that individual engage in that sort of activity again. And with, some injuries, a great option might be something such as sledge hockey. Okay, but if that is not an option, we need to dig a little bit deeper and find out what it was about that hockey that they really enjoyed, okay? And then seeing if we can find alternate activities for them to engage in. Because individuals who have disabilities and illnesses, the reality is that they tend to have a lot more free time on their hands, so to speak. And so it's part of our job to make sure that it is meaningful, that it is purposeful, and that it is productive, okay? So in terms of populations that we have the opportunity to work with, that's one thing that's great about the field is you are not pigeonholed into working with one particular population. You can work in the area of mental health, and that sometimes goes hand in hand with addictions. You can work in the area of rehab. Again, this could fall under, spinal cord injuries, but it could also, take working with an older population where you are working with individuals, after they have had a stroke. Maybe they've had complications associated with diabetes and they've had an amputation. And so you're having to work with them using different means of recreation and leisure to help them regain some independence so that they can continue on, living a very fulfilling life, okay? Complex care, pediatrics, acquired brain injuries. Those are all areas that we can work with. And the one thing that's fabulous about our program, and obviously I'm a little bit biased, but the faculty that we have teaching in our program have a ridiculous amount of experience, and they are all current and working in the field. So they are bringing to the classroom that current knowledge, those trends, what is working in the field right now, what is not working in the field right now. And that is translated into what you are taught. And in going through and taking a look at the curriculum that is part of the recreation therapy program, it has been designed with the Therapeutic Rec Ontario Essential Competency Framework in mind. So for students who are interested in pursuing registration with Therapeutic Recreation Ontario upon graduation, you can come to Lambton College and confidently know that our curriculum is going to help you achieve that goal. And just as one, again, I could go on and on about this forever because I get really excited about it. But something that is relatively new for our program is we do now have an articulation agreement with Seneca College. And so students who are graduating from the diploma program at Lambton College, if you choose to, you can continue on into year 3 and then year 4 of an honors bachelor in therapeutic recreation degree at Seneca College. And so many students do enroll in the program. They get in there and they figure out, you know what, this is awesome. And so they use Lambton College as a stepping stone. We give you that foundational knowledge, and we give you what you need to enter the field as a competent healthcare practitioner. But for those who are interested in taking it a little bit further, that opportunity is there for you. So I'm just looking down here, and I noticed that I'm creeping up to my deadline or my timeline, so to speak. So I'm going to finish it up there. If anybody does have any questions, I'm available anytime if you want to speak. You can reach out to Sean or marketing at Lambton College, and they will gladly point you in my direction.
Amazing. Thanks so much, Amanda. And I think just hearing your passion about the industry and about the opportunities for our students in our program, I think that just speaks volumes in terms of the experience that you're going to provide our students. So thanks so much for your time tonight. Really appreciate it.
No problem.
Awesome. Okay, so I think we'll take a quick break to take some questions. I know there are a few questions that we have in the queue. I do want to follow up on the previous question that was raised in terms of what is the starting rate for the OTPT graduates. And typically right now in the province, we're looking at about $18 an hour for an OP or a TP. So depending on what avenue you're going on. The other nice thing is there's many job opportunities. I think there's lots of options locally and starting at Lambton, but across the province and across the nation, there's definitely lots of jobs, as Melissa alluded to. And I think you can see the skills that you're going to learn in our program really boast well for your employability upon graduation. So $18 is an average. Obviously, there's some that are higher, some that are lower, but that's what we're looking at right now for that specific profession right now. Okay, so let's pull up another question. Okay, I'm going to get close here. I have heard that paramedic program is going to be a 3-year program. What will be the main difference between the 2-year and the 3-year? So that is a great question, and Ray from our paramedic program is actually going to present in a little bit. So he will definitely be able to touch on what that looks like, and if there is a 3-year option or a 2-year option, he'll be able to address that in just a few minutes. Next up, does Lambton offer scholarships or bursaries for SHSM students? If so, what are they and how do you get it? Great question, and really does kind of dive into a bigger topic in terms of scholarships and bursary opportunities for our students. One thing that Lambton College has always prided ourselves on is the amount of free money we give out to students. We give out over $1 million in free, I shouldn't say free, in scholarships and bursary funding every year. So there are scholarships for pretty much every student. So if you're a SHSM student, if you've taken a SHSM before, there's many opportunities. So on our website at lambtoncollege.ca and under My Lambton, you do have to be a student to look at some of these things. You can look at our registrar, our Department of the Registrar's office, so they look after our financial aid area as well, and that's where all of the applications are posted, and you can see exactly what it looks like. The nice thing on our website is you can filter by program. So if you're enrolling in the PSW program, for example, you can scroll and you can look at just PSW program scholarships that are applicable to students enrolled in that area. So really nice, user-friendly, easy to get to. So that's our internal funding options. There's also a lot of external funding options, whether that be through OSAP, which is always an opportunity, as well as there's many other websites that you can look at, Scholarships Canada, studentawards.com. There's a variety of other resources that you can go to really help kind of see what free money is out there and get some applications going for September. So great question. And I think there's one more question we're going to be populated. Are there any bursaries available to PSW students? So again, just as I mentioned, on our website, you can see exactly what scholarships are available or bursaries that are available for our PSW students on our website on My Lambton for sure. Okay, so hopefully that answered those questions. Again, any more questions that you have, feel free to post them in the chat. I think before we move on to the next program, I think this is a really great opportunity to highlight OSAP and talk a little bit about the registration piece and all of those steps that you might have to take once you have applied. So if students have applied to a program and you've been admitted to Lambton College, the nice thing is our registrar's office, you're going to be connected with an enrollment services professional. So that is one contact that you'll have for the entire length of your program. So from anything from getting into the program to ultimately submitting your application for graduation, it's the same person you would go to for any questions. So really great streamlined service, all making sure that you can get the answers to the questions that you have in an efficient manner. So that's the enrollment services professional. So after you put your application in, your enrollment services professional, they'll review your application and then they'll give you an offer. After you get an offer, you would go to ontariocolleges.ca, confirm that offer to the program that you're wishing to enroll in the fall, and that's when the emails will start to come in. So again, make sure you keep an eye on your email. It's very important, especially in these times. Email is, I would say, the #1 method of communication for our students. So definitely keep an eye on your email. That's where all of the important stuff will be filing through. So that's what that would look like. The other nice thing with OSAP, with the registrar's office, is our ESPs also help you through your OSAP application. So if you have any questions about OSAP or if you need any clarification, they can support you through that as well. So really is a one-stop shop. And I believe Hannah Mislin is the ESP for most of the health programs. So again, just knowing her by name, you can contact her. She's awesome. She's more than happy to answer any questions that you might have and really help guide you through the admissions process. So she's definitely available and ready to answer your questions. Now, the only other piece of that as well, my office, so I work in the student recruitment area, we have a team of enrollment advisors. So maybe you're looking at this event tonight or you've seen a few of our events in the series and you're still trying to figure out what program might be the best for you. Our team offers a wide variety of services for our potential students, whether that be live tours of our campus virtually, meetings one-on-one with our enrollment advisors through Teams, so you can get those questions answered with a real person, real time. We have info at Lambton College if you want to send us an email. We have a live chat on our website if you just have a quick question that you want to chat with somebody real quick. You can do that as well. There's so many ways to keep in contact with us and get those questions answered, and we're more than happy to answer those questions for you as well. So don't be afraid to ask any more questions this evening, or if you do have other questions that come up down the road, our enrollment team is ready for you. Our admissions team is ready for you. We're really just ready to welcome you to the Lambton College family in the fall. So I think that's enough of me talking for right now, and I am going to welcome the next coordinator up to the stage, or as it were, and that is going to be for our massage therapy program. So Kelly Ould is our coordinator, and she's going to talk to you about what's happening with massage.
Hi, everybody. I think I have a little movie clip to start us off. I'm Kelly Ould. I'm the coordinator of the massage therapy program, and I'm looking for that. So I believe there was music with that. I could sing for you, but I think I'll reserve that for another time. You can see in the background there is our lab. I'm not able to be in the lab this evening because we are running student clinics right now. So you'll be happy to know that we are a regulated healthcare profession that has been allowed to continue running our labs and our clinics. And I think this is important because massage therapy, well, number one, COVID, unfortunately, has put a glitch in a lot of people's lives. But massage therapy has been able to continue to run. And I'm happy to say that we've been able to continue to run our clinics and our labs. We are a 2-year accelerated program. So what that means is that we take 3 years and we complete you out in 2 years. We boast very small class sizes, which means that you get a really good amount of one-on-one attention, which is really important because you're learning a lot of new things. You're learning about anatomy, you're learning about massage techniques, you're learning about how to use your own body to perform this work. And so it's important that, that you get that individual attention when you need it. We have, I know it was said earlier that there's a bias, but I also feel like we're biased. So our program has been running since 2000, and our faculty is very, very experienced. We have faculty in the massage therapy venues, and we also have some chiropractors that teach with us as well. And collectively, we have well over 125 years experience. So that's quite a bit. We've all been teaching or practicing for a number of years. Number of us are still practicing in the field so that we get a chance to bring things in. And so it's a great opportunity. Right now, it's a great time to be a massage therapist. I was just in a meeting today with other programs at other colleges, and we were all commenting on the amount of jobs that seem to be available. And I've had a lot of companies, small companies, contact me looking for therapists. So you won't have a problem getting a job out there. And there seems to be jobs across the province that they're trying to fill. Our program has a lot of hands-on opportunity. We build it into the lab space as well as the clinical experience. And something that you should know is that across Canada, programs are moving towards accreditation. And Lambton College has its preliminary accreditation. And part of that is that we have to guarantee that the students get a minimum amount of hours with the public, 330 hours in that 2 years with the public. So that's outside the lab class. And so we have lots of clinical experiences, and your clinical experience starts in first year. So we think it's really important to learn your skills and then start to apply your skills working with the public so that when you do graduate, you are confident that you know what you're doing and you know where to find information as well. We have have a variety of clinics working with different members of the public. So I know that Amanda talked about those various types of opportunities as well. And we have very similar things. So we have our regular clinic where you could get anything coming in there. You could get people coming in with an amputation. You could get people coming in that have a scoliosis, or they've just sprained or strained, or they've got some kind of chronic problems, or they were in a motor vehicle accident and they have chronic problems. And so this career, you just never know what you're going to get either. So no 2 days are alike quite often. So if you like that kind of excitement, then this is pretty good. In the lab, you're going to apply your knowledge by safely practicing your skills. And I say safely because we do know we're in COVID, and so we want to reassure you that the skills that you'll be practicing are going to be in a safe manner. So we've got protocols set up in place to allow you to still practice with each other in a safe manner. You will be practicing on your classmates, and we think this is really important because before you start working with the public, I think need to know what things feel like and what things look like. And so I think it's really important to work with each other. So you do that throughout the 2 years, while you're also concurrently working with the public. Something else that we also do is we have quite an extensive prep course that prepares you for the provincial exams. So because we're a regulated health profession, we do have regulatory exams that you are required to take in order to practice in this province. And it is composed right now of a written exam as well as a practical exam. So we have a course that we put into place that is 12 weeks long that allows you to get prepared for the exam. So that further builds your confidence so that you know that you can go to the provincial exam with a level of confidence of success. And Lambton College has had many, many years. So as I said, we've been practicing since, we've been open since 2000. And so we've got 20 years, or so 17 years by the time we let people go to the exams. We've got many years of successful exam rates, which is important because you want to make sure that you choose a school that has a proven success rate at the provincial exams. Jobs. I'm going to go back to that just because there are a lot of different jobs right now. I want to talk a little bit about where you can work. So for those of you who really like the idea of running your own business, you've always been thinking to yourself, I would really, really want to have my own business, then this is the kind of profession that you can do that with. If you're not so much on that, but you still want to be able to work in the field, you can work in a multidisciplinary clinic, meaning that you could end up working with a recreational therapist, a speech therapist, a physiotherapist, a chiropractor, all for the community betterment of a client or a group of clients. You could work with other massage therapists. You could work on a cruise ship. We had a student who spent 5 months working on a cruise ship, just sailing the seas. It was awesome. You can work in a spa. So if you'd like that idea, you can work in rehabilitative medicine. You can work in hospitals. So we do have a wide variety of different options as well. And there is a need. There is a real need in this province for massage therapists. The average therapist, so depending on where you work, so bear in mind that most therapists don't want to work 40 hours a week because it's kind of hard on your body, but you can make a really decent living when you consider that massage therapists charge anywhere from $80 to $150 an hour, depending on where you are in the province. Obviously, you need to factor in your rent and things out of that, but you can make a really, really decent living out of that. There is lots and lots of opportunity here. I think it's a really, really important field. The other thing I want to talk a little bit about is longevity. So there's a rumor going around, and maybe you've heard it, that, oh, you don't want to go into massage therapy. They only last 6 years or 10 years. This is my 26th year as a practicing therapist. And I have nothing that hurts. I have no reason to move to anything else. I love this career. It was the best decision I made in terms of going back to school and doing something else. And it's kept me very, very engaged in my community. And so I think it's a really great career choice. So anybody who says to you, oh, you're not going to last that long, why would you do this? They've been misinformed. That might be the case maybe 20 years ago, but we've come a long way, baby. And lots of people last a long time in this profession. And there are people that are leaving because they've been a long time in the profession. And that may be one of the reasons that that lots of people are opening up their doors and requiring or needing a massage therapist. But if you want something where you can step out and you can get into a career and you can get into a reputable career, stay in it for a long time, then this is definitely the career for you. And Lambton College is the place to be. We've been doing this for a long time. We know what we're doing, and you're going to get the attention you need. That is that.
Awesome. Thanks so much, Kelly. I think it's always cool to debunk some of the myths of the industry.
Yeah.
And I know, like for myself, I'm very thankful for my massage therapist, especially after getting a hard workout in or whatever. It's always a great thing.
Honestly, who isn't? Like, I'm telling you, like when I first started out, before I became a massage therapist, I worked in a place and people would come in grumpy and then they would go get their massage and they would come out and they'd be the nicest people coming out. And I would be like, who are you? Like, what happened to the person that came in? So
you've changed,
so it just changes. And so, you know, my clients, I've had some clients for 20 years, you know. Awesome. So there's the opportunity there to have a really nice career for a long period of time. And if you don't like crowds, like if you don't want to be someplace where you have to work with a big crowd, this is great because it's all one-on-one.
Yeah, exactly. 100%. I think, and just knowing that there's a lot of job opportunities.
Yeah.
I know when we talk to prospective students, the job prospects is always one of the bigger questions, and there's lots of opportunities, which is always great.
Well, particularly this year, and I was just at another meeting and we talked about that, and I was meeting with people from different areas of the province, and we were all commenting on how many job opportunities there are out there, and people can't find therapists. And so this is definitely the place to be right now in terms of walking into a job. And we all commented that most of our students, most of our grads have jobs waiting for them before they graduate. And so that's really, really important, I think, to consider that you know you're going to step out into a waiting job.
That is awesome. No, I think that's great, and also having the clinic on campus to really give those hands-on experiences for our students adds so much to the program and the skill set that our students gain. So, again, really great overview. I really appreciate your time tonight, and we look forward to welcoming the Fall 21 cohort into the massage program in September.
Yes, I'm very excited.
Awesome. Thanks so much, Kelly.
All right, thanks.
Okay. So again, massage is a really great opportunity, and maybe one of the lesser known or the career profile in health that maybe some people might not always think about. But as Kelly mentioned, there's a lot of opportunities, a lot of areas for growth, and a decent income can come out of it as well. So if this might be something you're looking at, definitely don't hesitate to look at Lambton, look at our program, because we definitely have the facilities and the curriculum that's ready for you. So next up, we have our paramedic program. Paramedic is another long-standing program at the college. It has produced hundreds of graduates that are on to do amazing things now. And Ray Pettigrew is our coordinator. Recent retired paramedic as well. So for a long time, he's been doing double jobs. But now we're happy to have him leading our program still. And he's going to talk to you about the program, and then he'll also touch on that question that was raised earlier as well. So Ray, take it away.
Oh, thank you very much, Sean. It's nice to be here and spend some time talking about something that I'm particularly passionate about, which is paramedicine. Sean mentioned I've been involved in the paramedic community for over 30 years now. I've worked both as a primary care paramedic and advanced care paramedic, and worked in multiple different services, sometimes part-time, along with a full-time job in other services. And then I joined the college team in 2005 when we began the program at Lambton College, and I became a full-time employee in 2013, and a couple of years later started coordinating the program and have been ever since. So it's something I'm really passionate about. We can move to the next slide there. Just got a little slide presentation for you. So, I mean, if you're the kind of person that doesn't really like to sit behind a desk and is okay with not knowing what you're going to be doing on any particular day and at any particular time, paramedicine is definitely something you'd want to consider. The one I loved about going to work every day when I was a paramedic or working in the field still was the fact that you just never knew when the tones are going to go off and what you were going to be dealing with or where you were going to be doing it. The office is typically the back of the truck, but the patients can be anywhere, and that's kind of an interesting part of the work, and you just never know. So that part of the job appeals to certain people, and I think if you're one of those types of people, choosing Lambton College Paramedic Program would be definitely something that would be worthwhile. We have state-of-the-art actually facilities here at Lambton College. We've made huge improvements in our campus and the health facilities in the last couple of years. We have a beautiful new paramedic lab with multiple rooms that we use. We have an ambulance simulator, so we have the back of the truck is there, so students get used to lifting, to being in that space and working in that space as if they were a paramedic out in the field. And we also have a DriveWise simulator that allows students to kind of get some information about what would it be like to drive an ambulance, and we go through kind of the safety of all of that. And we also have some excellent clinical partners. Lambton College kind of prides itself in that, it's a small community, but we have some amazing partners, Lambton EMS, the local hospital group that we use as clinical placement as well, that you would have access to as a paramedic student. And then great preceptor opportunities. We spend a lot of time honing our relationships with other services across the province. And the big benefit in that for students is the fourth semester of the paramedic program is all out riding. So currently, somebody mentioned, is it possibly going to be a 3-year program? It is currently a 2-year program, 4 semesters. And the 4th semester, you're assigned with a paramedic and you actually work with that paramedic, going on calls and assessing patients and treating patients in real time, actually doing the job. So the fact that we have these kind of relationships across the province, a lot of students choose to go back to their home communities and work in a service near there, where they're more inclined to want to work or gain employment. And that's a huge benefit. It's also a cost savings during the 4th semester. They're not paying for rent and so on away from home. So many students make that choice. Okay, move the slide. Thank you. So the admission requirements. This is another thing that I'm fairly proud of, is we don't actually ask for a whole lot over and above. We don't say you need, certain fitness level. We don't ask that you have an F license, particularly which you need to drive an ambulance. But we just look at the minimum grade level. And so we have grade 12 English, math, chemistry, and biology, and they can be college, university, and the minimum grade is 70%. And what I would caution people, though, however, is that the cohort that you're kind of applying with has a high average. So in other words, if a lot of the people applying were in the high 80s or low 90s, those are the people that are going to come. So we're just looking at grades and grades only. When I mentioned the F license, however, I would say to drive an ambulance, you should try to get that as soon as possible. While it's not a education requirement, it is a work requirement, and you can actually start applying for work or jobs in your 4th semester as you near graduation. So having all those things completed is really important. And go to next. Lambton College is really proud of the fact also we are an accredited college. We have a national accreditation through Equal Canada, and we currently hold a 6-year accreditation status. And you may wonder, well, what does that really mean to me as a student? And the big thing is that what it proves to you is that Lambton College paramedic program has kind of checked off all the boxes in terms of what it takes to become a paramedic, and what nationally we're looking at all the different skills that we would expect a graduate to have. And a third party has looked at our program, evaluated it, and agreed that we're checking all the boxes efficiently. And indeed, when our graduates graduate, they are good to go. And so they've met all those requirements. So it kind of gives you some peace of mind in terms of choosing a college. If you choose a college that has an accredited program, it's an added benefit for you. The other thing is it makes it a little easier if you choose not to work in the province of Ontario. Moving to other provinces in the country or territories is easier if you're coming from an accredited college. Right. While you're here at Lambton, we have a number of volunteer opportunities that kind of give experiential experience to our paramedic students. We've partnered with a local junior A team, Sarnia Sting, and we do first aid and kind of first response there. We participated in some campaigning with MAD. We've had first response at under 17 hockey tournaments that are held locally here prior to COVID, of course. And we also participate in kind of local high school football sometimes to provide first aid to them. So there's a number of those volunteer opportunities that come up from time to time that we engage in and give our students an opportunity to go out and kind of show what they can do and also gain some experience as a first responder as well. Moving to graduation and progression. One thing I just, sometimes some college courses, you only require 50. Not say only, but you do require 50. In the paramedic program, it is a 63% in all courses, except in the fourth semester, there's one course that's actually just 2 exams, cumulative exams, that you write that mimic the provincial exam that you have to write after you graduate. And you have to get a 70% on that. So obviously you have to complete the other courses that are associated. Our graduates or students take English. We have a big focus on physical education because there's quite a bit of lifting requirements that go with paramedicine. And of course you take some gen eds that are kind of some other courses that are kind of unrelated to the paramedic program that might be of interest to you that kind of enhance your overall education experience while you're here. So once you're done, as I mentioned, then you meet the requirements to write the provincial exam to become a paramedic in the province of Ontario. All right. So employment opportunities, anybody coming in right now or that's in the program or graduating right now couldn't be doing it at a better time. Paramedicine has a lot of different opportunities that have kind of occurred over the last few years. We're very proudly one of the emergency services that have pretty much equal representation for both men and women. So there's lots of opportunities in terms of, regardless of who you are and your background and so on. And that provides a number of additional jobs. You may have heard of community care paramedicine that's happening. It's largely service dependent right now, but many services are offering community care paramedicine. So they're taking paramedics that they have on staff and they're moving them into that community care area. And that's opening up more opportunities for graduates that are just coming out to backfill those positions. And then one thing that people always ask me is, if I want to be flight or if I want to be critical or if I want to be advanced paramedic, those opportunities are out there, but you must be a primary care paramedic first. And then you can move to advanced care paramedicine and you can move into critical care and flight. So you have to kind of do it in those steps. It's also beneficial, getting back to the accreditation part, you can actually move into those a little easier if you're coming from an accredited program as well. So lots of employment opportunities, and most of our grads currently are getting jobs, and even they're getting work initially even in COVID clinics that the EMS services are involved in. So lots of opportunities for graduates right now, which is exciting. Moving on, I know everybody's probably really interested to know what the fall is going to look like, and I didn't hear Savannah speak first today, our dean, but I know just based on kind of having my ear to the rail, so to speak, that the decisions are being made, and I know we're contemplating what's going to be safe and what opportunities we can actually bring online. But definitely for paramedic program, you can be assured that the labs are running. They're coming in small groups, 5 students with 1 faculty, and they're open. All our preceptorship and clinical placements are also open. So you're going into clinical placement with no particular issue at this juncture. And then we're just kind of looking right now at our academic courses and trying to decide which ones may best suit coming in if we can, or ones that might remain online. So there's going to be some variation depending on the course, what that's going to look like in the fall. But we're really excited. I mean, we've moved through the COVID experience really quite well. I think Lambton College, the leadership here, our senior management, our deans, all faculty are really committed, regardless of the challenges of making sure that our students have a really good experience when they're here and get everything they need. And they really spend a lot of time ensuring that that happens. So, you know, if you're thinking about Lambton College paramedic program, you can rest assured that we have some really good people working for you. And all our faculty, Kelly made a mention of her massage faculty. All our faculty are working in the field. They're actual, you know, advanced in primary care paramedics. Some work in management positions as well. So the level of education and the level of paramedics that you're going to be working with really is at a high level. One question I know Sean mentioned, I think, was the question about the 3-year program. And currently, as I said, it is a 2-year program, and it was potentially scheduled to move to a 3-year program in 2022. And typically what happens is that they need about 18 months between kind of announcing that and when that program will start. And with all the things happening in the province with COVID, the minister just didn't pull the trigger essentially on the 3-year program at this point. Whether it'll move to that in 2023, it's a possibility. I think when you're looking at that and wondering, you know, what would the difference be? I think, you know, in the last, you know, many years, there has been no change to the length of the program, but paramedicine has grown exponentially in terms of the skill set and what paramedics are required to do, and all the drugs they're giving, and they're doing IVs, and we're doing all sorts of advanced procedures at the primary and advanced and critical levels. So there's huge differences in paramedicine. What we really need is more time to have the student a more gradual process, to teach them those skills, to spend more time with those. We do get it, you know, we're confident that we meet those requirements in a 2-year program. But we would probably benefit, and the student would benefit probably in the long term by having a little more time to absorb that material and spend more time in the college setting. And I expect that will probably still happen, just not happening right away.
Awesome. Thanks so much, Ray, and thanks for touching on that 2-year versus 3-year question. I think that is a good note. And like you said, until an official announcement is sent by the college, everything is kind of status quo. The 2-year program is still the program with all of the benefits that you talked about. So thank you for your time tonight and giving the overview of your program. Much appreciated.
Oh, thank you very much. It's nice being here. Appreciate the opportunity.
Awesome. Thank you. Okay, so we are coming up to the last program of the evening, and that is our personal support worker program. So I think as many faculty mentioned tonight, there's definitely lots of jobs across the healthcare sector. Personal support worker is no exception to that. There's definitely a lot of opportunity for personal support workers right now. Growth is being seen across the province, across the country in terms of positions available. And we have a really great program. We have an amazing apartment lab. Our students utilize the nursing facility as well. So we have a faculty member, Jennifer, is joining us from the nursing lab this evening, as well as one of her students is going to be joining us as well to give you an overview in terms of what's happening with personal support workers. So take it away.
Hi, everyone. Welcome. Thank you for your interest in the personal support worker program here at Lambton College. My name is Jennifer Phillips, and I am one of the faculty that teach in the program, and I'm thrilled to be on location in our beautiful, modern health skills lab that you, as a student, will be learning your core essential skills in. So if you're the type of person that has a passion for helping other people, making connections with people matters, helping people live the best life they can live, then you want to think about being a personal support worker. Especially now in these crazy times, being at home and functioning independently is so important. And you as a personal support worker are on the front line making a positive difference in people's lives every single day. With me today is Kaylee. Kaylee is a recent graduate from Lambton College, and she's going to demonstrate how she would assist a client getting out of bed. Please listen carefully, because Kaylee's going to talk about her technique and why she's doing what she's doing in order to provide her client with safe and effective care. Okay, Kaylee.
So this program is top notch, and the teachers you are going to meet are incredible. And I've learned a lot. And one of the things I'm going to run through you today is something called DIPS. Dignity, Independence, Privacy, Preference, and Safety. Hello Melissa, how are you?
I'm good.
Good. My name is Kaylee and I'm going to be your PSW today.
Hi, Kaylee.
So the first thing I'm going to do is I would draw the curtains around, providing dignity for my clients so nobody can see what we're doing, and privacy as we talk. Now, how did you sleep last night?
I slept okay.
Yeah? Oh, that's good. Are you feeling dizzy or nauseous this morning?
A little bit.
All right, so what we're going to do is I'm going to be moving you up and around.
Okay.
At any point in time, if you're feeling uncomfortable, just let me know and we'll stop and reevaluate, okay?
Okay.
All right. And hand hygiene, extremely important, especially in these times.
Okay.
All right, so what I'm going to do is I'm going to raise the bed up to my belly button level so that I can safely get you up, protecting both you and me. So you're going to feel it rise, all right?
Okay.
Good. All right, and then what we're going to do is we're going to roll. Do you have a side that you would rather get up on?
This side's fine.
Perfect. That allows her to have an opportunity to choose, so it's her preference, especially if you have a client that's maybe a little bit more sore on one side than the other. So I'm going to lower this. All right, so to do this, I'm going to have to put my hands on you and roll you around. Are you okay with that?
Yeah. Mm-hmm.
Perfect. So to maintain some independence, I'm going to have you lift this hand and you're going to put it across your chest.
Just
and
like
hold
that?
on. Just like that. Good?
Okay.
And I'm going to get you to raise this knee up so that your foot is flat and you're comfortable. How does that feel?
That feels good.
All right, I'm going to put one hand over, and we're going to roll on the count of 3. 1, 2, 3. Good. And now we're here. I'm going to check to make sure that you're feeling okay.
I'm fine.
Perfect. One hand over, one hand under, so she's supported. Hand underneath, and we're going to sit up in 1, 2, 3. Up and there. All right. I'm going to have you hold on nice and tight. Now, how do you feel?
I feel good.
Perfect. So that is one of the ways that we get our clients up and out of bed, making sure, again, that they're respected, that they're safe and you're safe. Yeah, you're about to learn that all.
Okay. Thanks, Kaylee. So our personal support worker program is an 8-month program. We have a theory component that's taught by competent faculty from diverse backgrounds, and we have a really comprehensive clinical practical experience where you'll be with instructors that facilitate your learning the entire way. Listen, there's never a better time to get into healthcare career than now. People in our community need help. It is so important to function independently, and as you can see, some of these things that we take for granted every day, there's people out there struggling just to perform those tasks. So if you have any questions, we are here to answer. We hope to meet you, and we will try to work with your schedule, and it's very exciting career. Nothing better than helping people. Thank you.
Awesome. Thank you so much. That was a really great overview. And again, it's really cool to see what our students are learning and how they, all the skills that they utilize, and being in our nursing lab really just kind of adds to the experience as well. So thank you so much, everyone, for that overview of our personal support worker program. Okay. Well, I think that brings us to almost a close. I think there's a few more questions. So we will pull those up to see what any last questions people are asking, and then we will wrap up for the evening. Current wage for PSW, that is a great question. I think, again, average, the wage would obviously depend on the city that you're working in, but I would definitely say probably the 18 hour. It would depend if you're working in a long-term care facility, if you're working in potentially a hospital setting. So it definitely does vary. But I think there's definitely lots of job opportunities as well, right? So there's a lot of work available, and the wage will be dependent in terms of what avenue you want to go into. So there's definitely a range for that one. And last question, okay. Will PSW be hybrid style at the beginning of learning and then at school? So again, really great question that you brought forward. I think as you can kind of see, we definitely want to be able to bring students on campus. So those decisions are still being made, as Sylvana kind of alluded to, but our goal, our number one goal as a college, is to bring as many students on campus as we can in the fall. So we are going to be working to see how we can make sure you're going to get the theory probably online, but ultimately the hands-on skills is likely going to be inside of the classroom. So again, those decisions are still being made. Everything will be communicated out to students once everything is finalized, but that is definitely our goal, to make sure you can get the hands-on experience inside of our labs in person, with any safety precaution that we need to take is being handled as well. So really great question, and thank you for raising that. Okay, so I think that brings us to the end. I hope you all got a little bit more information tonight that you were looking for. I think it's pretty clear that there's a lot of opportunities in the health sector, especially right now. So if you are looking at a career that's all about helping people, this is definitely a sector, and likely some of these programs are going to be a fit for you. I think we can all say that we're very thankful for our frontline and healthcare workers right now in the pandemic, and I think, again, really great avenue to go down. So thank you so much for joining us this evening. If you do have any follow-up questions, I am more than happy to answer those. So you can email me. My email is my first name dot last name at lambtoncollege.ca. And again, I'm happy to further support your questions and any information needs that you might have. So thank you so much again for joining us, and we hope to see you in another one of our episodes in the school session series.